All right, it's 1:30 a.m. I guess you'd say it's day 4. But it's in the middle of the night, day 3, whatever you want to say. But I woke up very congested. I couldn't get anybody to come in and assist me. And I had to cough really bad. And it was causing me to cough uncontrollably. And every time I coughed, it felt like it was ripping away at my sutures and this drain tube. So I knew I had to get out of bed. I detached myself the best that I could from the things that were on my feet. They're like these compression things on my feet, and unplugged my tower that has everything hanging from it from the wall. And I disconnected my CO2 and took to the hallway. And I walked 10 laps with my alarm blaring, just trying to clear my lungs. But it worked. I was able to walk, clear my lungs, be more comfortable. I just hate this situation on the weekend where they just don't have enough people to be as attentive as they need to be. Certain people aren't allowed to do certain things. So I'm trying to be responsible. At the same time, these things come up and I have to take care of it because it's just urgent. So I don't suggest that to anyone. You don't want to fall. But I was just so desperate today. I'm just relaying what happened with me. It's a really early post. Okay, it's 3:30 a.m. I'm in a lot of pain, and it's hard to breathe. Okay. I gotta get this. I gotta get this coughed up. I gotta do what I gotta do to get this coughed up. 4 a.m. and just did another 10 laps. Breathing so much better now. Let's go. Let's go. God has given me so much strength. So many people have been praying for me to get through this. Whenever something comes up that needs to be done, I just feel so motivated. I feel like I don't ever feel like I'm ever alone. And that's huge. I mean, it's nice for my wife or somebody to be here, but I never feel completely alone, and I know that's because I'm not. And so I thank God for the strength He's given me, the peace He's given me. It's what's getting me through this. Yeah, I got to do my part, but I can't do it without Him. This is all the fluid that's come out of my lung where they have that drain. You can see it. It's all the fluid that's come out of there. I'll be glad when I get that thing out. Okay, it's 5:05 a.m. It's been a difficult morning. That's my CO2 alarm going off, I believe. Just trying to clear out my lungs. I finally got the big patch of mucus in my lungs out. by using a combination of walking, both of the breathing devices, and pressing the pillow against my chest and coughing while I'm in the chair. Finally got it out. Okay, I want everybody to understand that even though this is day 4 for me, because the day of surgery was day 1 of surgery, according to the hospital, this is day 3. The day of surgery is considered day 0. So when they said they would have me up and walking on day 1, that's what they meant, was the day after surgery, because the day of surgery is considered day 0. So for our purposes of documenting everything, this is going to be our surgery day 4, and we started at 1 instead of 0. I just wanted to clarify that. All right, I just spoke with the doctor. He said that I'm doing extremely well, that I have smashed all of the benchmarks, that I have exceeded all the expectations, so we're on a good path. So tomorrow we can do a test to make sure that nothing's leaking, and then if that test comes back that we're not having any leaks tomorrow, then we can swallow something. So I'm not sure what that's going to be, but I can't wait to be able to put something in my mouth and to swallow it. I tell you, the things that we take for granted, it's crazy. I have to say that the staff here has been wonderful. There's been some hectic times when they're in transition, where they're changing shifts, and sometimes your needs as a patient, they just don't work well with what's happening with the other patients at that time. So, I mean, they can only do what they can do. But they've been very nice and very helpful, and I really appreciate all the people who have helped me to get through this very difficult process here. There's been times when I've had to press my call button, 3 and 4 times just over and over again, because I just can't seem to get comfortable, or I need to change position, or I need access to something I can't reach. But now that I'm getting to where I can actually move around myself, I'm learning how to detach things that I'm allowed to detach, and be more mobile. It's definitely helping the situation, So, and that's what it's about anyway. It's about being safe and responsible, but also being as independent as you can be. Just trying to find that balance with something that's new to you. I think everything's going good. So far, I've been in just my boxer shorts and my robe. It's just been a lot more comfortable that way. I brought like pajama style pants, stuff to change into, but there hasn't been a need to do that. I've been bathing, once a day. My wife has been helping me with that, and putting on clean compression socks and walking socks and clean boxers and a clean robe. So far, that's been working really well for me to do that, as opposed to try to put on any kind of a garment. But once I get these hoses out, I think I'll get fully dressed that time. At least that's the plan right now. All right, so it's 6:30, and just had some acid come up to my throat, like the indigestion. I have not had absolutely anything by mouth, so it's strange to me why I would have acid coming up. I was actually sitting up in the chair, taking a little nap. And when I woke up for them to do my blood pressure, I was burping up the stomach acid. So let's see if we can do something about that and bring it up with the nurse. But I just wanted to document it here on day 4, which is day 3 for them because they have day 0. But today's Sunday. The surgery was Thursday, and I'm having some stomach acid come up my throat just randomly. They did increase my feeding today, where I'm getting more food into my feeding tube. So maybe that's got something to do with it. We'll see. Okay, it's 7:30 p.m. I was supposed to have had my medication at 6 o'clock, but they're out of it again, so I've been having to hit my morphine button. I'm waiting for them to do my medicine, but something really feels off tonight. I can't explain it, but I don't know. This morning when I had my little event where I couldn't breathe, I was trying to, throughout the day, to set up something to where I wouldn't have that event again. They had sent someone with physical therapy to walk with me, and the person from physical therapy had said that I should be able to schedule a walk with my nurse. So I thought that it would be a good idea for me to go ahead and schedule a couple of walks throughout the night, to have the nurse come in and wake me up and get me untangled from everything and get me started on my walk in the hallway to avoid another event. But somehow or another, that got translated to the staff feeling like I was trying to say they weren't doing their job or that they weren't being attentive. And I don't know where that came from. It was just like totally out of left field. I went from everything being okay to feeling like the entire staff here was against me. And it was very unsettling. And I was just trying to, be responsible and not put myself in such a bad situation again. But I think something must have gotten lost in translation somewhere, because the girl who worked for physical therapy, it's not her place to tell me what the nurses can do. But of course I didn't know that she didn't know what the nurses can and can't do. And I walk a lot, so they may have thought that I meant that they were supposed to be beholden to me, like they're supposed to stay with me the entire time. But it wasn't that at all. I just wanted somebody to help me to get out of bed and to free myself from all these cables. Because, waking up in the middle of the night and you're in respiratory distress, you can't breathe, and every little cough that you make is excruciatingly painful, and you've got all these wires hooked up to you. I mean, it's a lot. So I was just trying to avoid that. But unfortunately, in me trying to arrange things to avoid it, I seem to have upset some people. So it's unfortunate, but was not my intention. And I have to do what needs to be done to make sure that I get the things that I need, so I'm not in that situation again. So it was unfortunate that I had to have that. And now, at the same time, I'm not able to get my pain medication because they say that the pharmacy doesn't have it. And so, I don't know, maybe I'm being a little overly reactive myself to the situation now, but I'm thinking, are they purposely withholding my pain medication because they think that I'm somehow acting this way because I wanted to set up these walks? I mean the whole situation is just very unfortunate, and I just need to forget about it and just use my button until I get my medication. And when I get my medication, try to relax. And hopefully that won't be much longer. Okay, everybody, so I'm going to finish up this day 4. They finally brought the pain meds at like 7:30 p.m. And I'm feeling more settled now. I got in another 10 laps, and I'm ready to just relax a little bit. I already took a little nap, so I'm gonna find me one of these movies on Netflix that I downloaded and watch a movie, and just try to relax. And I get this video edited and posted for day 4 of surgery. So what started out as one of the worst days finished up pretty well. So I guess the thing to recap was that hopefully the test tomorrow will give me the ability to swallow and maybe even get these chest tubes out. And it'd be nice to actually drink some grape juice like they said. So hopefully everything goes well with that. I may be just kind of sleeping little naps tonight in the chair. I think that's the surefire way for me to avoid any kind of a situation where I'm waking up and I'm not able to detangle myself. And so might see how that goes for a while. So I'm planning on trying to stay up a little bit and do a few things. I'm feeling good now that I've got my meds, and I'm looking forward to a new day tomorrow. And to everybody out there who has followed this experience for whatever reason, thank you for keeping me company. Because when I do make these videos, I do feel like, I'm, sharing it, like I'm, somebody's keeping me company and all this, and it gives it a greater purpose. So I'll see you guys in the next video. And I hope that you're having a good day and enjoy the day you have.